Good morning and welcome to our live stream from Deuk Spine Institute. I'm Dr. Ara Deuk-Majan, CEO and founder. We are here with a patient who travels from Norway for his neck. He has already had fusion done in Germany by German surgeons, and he's now developed what's called adjacent segment disease. You will see in just a moment on the x-ray that he has a crooked neck from the fusion and the adjacent segment disease. He'll have a metal plate, he'll have cages. I'll show it to you. As a matter of fact, I don't think they did a very good job at all. You can see, let's go to the x-ray. You see that?
Yes, we do.
All right, so shot. Look at the tip of my probe. Shot. You see the hole right there? There's not even a screw in there. They left the screw out. I have never left a screw out on an ACDF plate. Second of all, the plate is a very poorly designed plate. It's too wide, it's too long. They use too long of a plate. So, long story short, stay away from fusions, even done in Germany, where the surgeons are supposed to be really good because they don't do a good job. He's developed now 2 discs below the fusion, C5-C6, that are now herniated, degenerated. We're going to fix those later, but we're going to start by fixing the facet joints, which are extremely arthritic as a result of adjacent segment disease. Feel free to ask questions. We're going to get started. We're performing a Deuk plasma rhizotomy. What is that? It's a rhizotomy procedure to destroy pain nerves causing his pain. All right? And these nerves are located in the back of the spine. Shot. And Jordan, will you be kind enough? I'm going to make my incision to show us where those nerves are. That's right. Shot. The nerves are right in that area. You see all the arthritis there in the facet? That's where the nerves are. So we're going to go and destroy these nerves. It's called the medial branch of the dorsal ramus. Now, other doctors don't perform what we do. They perform something called a radiofrequency ablation, which doesn't work, by the way, so that's why we don't recommend it. We used to do them, but the problem is they don't work because RFAs don't destroy the pain nerve like they're supposed to. In theory, they sound good, but it doesn't actually work. And if you ever talk to a doctor who does RFA, they will tell you, this is temporary. You're going to have to come back and get this procedure done again. Okay, that's because they're not a permanent fix, whereas our treatments are. So, the Deuk plasma rhizotomy is a permanent rhizotomy. It destroys the pain nerves permanently. Shot? Okay, just about there on the first target. And, yep, I feel it. And I'm killing the pain nerve right now as we speak. The first pain nerve is at C4. Shot? Right where the tip is. Show us where that nerve would be, Jordan. Yep. Just to the left of that tip. All right, I can feel the bone. The key here is you have to dance on the bone with your probe, and we have patented this treatment. It's not available anywhere else in the world. I developed it. It's called the Deuk plasma rhizotomy, named after Deuk Spine Institute, where it was patented. No one else in the world does this. We're the first, and this will replace all RFAs one day, radiofrequency ablations that don't work. RFAs don't work. This procedure will replace them. It is the next evolution in rhizotomy, and it can be applied any joint in the body. Hips, knees, shoulders, spines, tailbone, you name it, we can treat it. We've even done thumbs and toes. All right, if you have questions, feel free to ask. We're almost done. We're going to be finishing in just a moment. Dr. Berndes has done a phenomenal job with the anesthesia. Our patient is snoozing. He is from Norway. He traveled here to Florida for this procedure. He could go anywhere in the world he wants, but he wants the best. So he came to Deuk Spine Institute for his neck pain. We're going to get him out of pain. Now, unlike the laser surgery, this procedure hurts after surgery. People have pain in the muscles because this procedure, there is a little couple of drops of blood, and if you get a drop or two of blood in the muscle, it's going to cause muscle spasms for several weeks, if not months. And that's why patients who have this Deuk plasma rhizotomy procedure, they have pain in their muscle for about a week or two on average. Some of them, it could be lasting up to 2 or 3 months. I've even had one patient with 6 months of postoperative discomfort in the muscle as a result of this procedure. But it's not common. Most people have just a few days and the pain's gone. I'm literally feeling right where the nerve comes around the side of the bone, the waist, it's called the waist, W-A-I-S-T, of the lateral mass. We're almost done, another minute and we'll be done. If you have questions, type them up. You're also welcome to join us. We're going to be flipping this patient over in a moment and doing a Deuk laser disc repair. That is the endoscopic laser surgery to repair. He has 2 really bad annular tears at C5-C6, C6-C7 below his fusion. Those annular tears are painful. Henry, speaking of pain, let's show the audience how do facet joints in the neck, how do they cause so much pain for patients?
Of course.
And now you can see from our video how facet joints can be so painful for patients. It's the arthritis in the joint. Henry, let's show our audience how this procedure takes the pain away. How does this Deuk plasma rhizotomy work?
Of course.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see from our video that we go in and destroy the pain nerves using our Deuk Plasma 1. That's the incision, folks, 4 millimeters. We're going to just band-aid it. Right now we're putting a staple, and we will be back in about 10 minutes with our next stream, which will be the Deuk laser disc repair. Remember, we just fixed his facet joints, but we have not yet fixed his disc. So we're going to go fix the degenerated disc next.